Healthcare is something that I am very passionate about, and along with affordable housing, the skyrocketing cost of healthcare is among the biggest challenges facing middle-class families here in California. This is certainly the case for the workers that we represent. Our local union, Teamsters Local 856, represents 13,000 members working at nearly 200 different employers in both the public and the private sector, in every industry you can think of, from school employees to law enforcement, from hotel workers to airline mechanics. And while the workers we represent are very different, there's one thing that is consistent across all industries and sectors where our members work. Healthcare is the most challenging issue we face at every bargaining table. The challenges workers face around healthcare are significant. The skyrocketing cost of healthcare is making the employee share of monthly medical premiums reach unaffordable levels. And as more and more money is being diverted from salary to healthcare, there is downward pressure on wages. We've also seen rising healthcare costs result in fewer plan choices, benefit level reductions, and worst of all, more employers are attempting to limit access to health care through the use of part-time and temp workers. And whether it's the employer paying for it or the employees, it's absolutely unsustainable. On our self-funded direct pay PPO side, I was told by our experts the only way to reduce cost was to create a skinny network of hospitals. In other words, cut out the hospitals that charge the most. But here's the catch. That would eliminate 30% of the hospitals that our members depend on using. And of course, that's a non-starter. As you can probably guess, I'm frustrated. I'm disheartened. The status quo is just not sustainable. I can't help but feel like we're at a breaking point, that we're out of options for workers and employers to solve the issue of skyrocketing healthcare costs at the negotiating table. We need a strong legislative solution that controls costs throughout the system, from hospitals to insurance companies. And I want to close by making it clear. Working people across the state stand ready to work with you to accomplish this goal and solve this problem. We can't afford not to. Thank you.